Hey everyone, Dr. Matt Geller here. I'm back here in the studio, San Diego, California. Hope you're having an amazing time at Eyes on Glaucoma. I've got a very special guest for our next guest here, Dr. Nate Lighthizer. Let's bring him on. All right, how's it going, my friend?
Good. How you doing, Matt?
I'm doing well, enjoying the show. How about you?
What a wonderful platform. What a wonderful show. You guys have got experts from the entire eye care field here. So just well put on, and congratulations to you guys. And I hope the attendees are enjoying it. An outstanding conference.
Yeah, thanks so much. We couldn't do it without you. You're a must for a show like this, and we certainly appreciate you supporting it. So let's jump into this topic. I think this is a really good one. This session title, we've got Digital Duet, Changing the Education Paradigm for Future Eye Care Professionals. So for those that don't know you, can you give a bit of background about yourself and also just in general, your passion for optometry and eye care?
Yeah. So born and raised in North Dakota, did my schooling out at Pacific University. I graduated in 2009, and I went down to Oklahoma where I did my residency at the Oklahoma College of Optometry at Northeastern State University in Tahlequah, Oklahoma. So I'm at an educational institution. I am now an associate professor and the associate dean of the College of Optometry, serve in various roles as the director of continuing education, among other things. Love optometry, love eye care in general, collaborating with optometry and ophthalmology. To me, it's really all about patient care, educating our future eye care professionals, the students and residents that are coming along are going to care for our future patients. So it's a passion of mine, love education, love doing things like this with you.
Certainly, and you're an expert at it. You're the best of the best. So when it comes to glaucoma care, because you participate and see a variety of patients and a variety of conditions, but tell us, kind of where does your intersection of glaucoma care happen at your clinic and with the university and whatnot?
Yeah, so we're very fortunate at the Oklahoma College of Optometry located in Tahlequah. We are the eye care provider for Cherokee Nation. So we see a lot of patients, have a lot of entities to see and conditions to manage, glaucoma being one of them. We have a glaucoma clinic where we manage all of our glaucoma patients, and we have a huge number of glaucoma patients, and we have a formulary that we operate off of through the Cherokee Nation where we prescribe eye drops, things like that. I spend a lot of my time in what we call specialty care clinics. So when glaucoma patients need further therapy like SLT, Selective Laser Trabeculoplasty, they're sent to our specialty care clinic where we will manage SLTs and do capsulotomies and other laser procedures, OCTs, OCT angiographies, things like that, specialty eye care. But that's one of my large roles in our glaucoma patients, is managing when they need a little bit more than eye drops, as we just talked about with the use of lasers in glaucoma at the lecture in the last hour. But that's one of my biggest roles is in glaucoma, is managing these patients when they need a laser procedure, which I do quite often.
Yeah, lovely. How are laser procedures like the Digital Duet, Digital Duet from Lumenis and SLT, how's that changing the paradigm for education for optometrists?
Yeah, education is certainly critical. When you're educating somebody how to do a procedure, it's kind of you see how it's done. You've got the background and the theory from lectures and watching videos. But the next step after, getting the theory and listening to something on the theory and how you do it is then watching videos and then watching a live procedure. It's kind of a see one, do one, teach one. That's the medical school mindset. I think it's very, very spot on. So when I do one, I need our fourth year students, third year students, our residents to be able to watch how we're doing that procedure, so then they can assist in that, observe. So then when they're at the control and they're doing their procedure, they've got a comfort level that's there. So having the ability to have students and residents watch a procedure, we can take photos so we can teach in the classroom, teach in these continuing education lectures. It certainly is a nice thing to have. And companies like these laser companies, Lumenis, with their Digital Duet and their Digital Trio, that now has imaging capability right into the laser, so we can see in live time, in real time, what's the picture of that angle look like during an SLT? What's the iris look like as we're doing a peripheral iridotomy? What's the capsule look like as we're opening it up on a YAG capsulotomy? That's crucial for our understanding and learning for our students and residents. So having that imaging built in with the Digital Duet is a really, really nice feature. And then to have those images and videos uploaded to the EHR makes things really, really nice.
Yeah, absolutely. And Oklahoma is such a unique state for this. I mean, in our 2021 glaucoma report here, when we asked, docs, 667 ODs, what was their preferred go-to-line treatment for POAG, 6.4% was SLT. But when we asked the very same group if they were diagnosed with glaucoma, what would be the primary treatment option for themselves? It was 33% SLT. And so, we can only hope, of course, that more ODs will be able to have the ability to start doing SLT in their clinic, just like you guys have. And I'm sure it's been an incredible just teaching journey throughout. Any reflections there? Are you finding that docs are more passionate about starting to use SLT in your state? And I'm sure you're just loving being a participant in all of that.
Yeah, absolutely love it. It's one of my main passions of seeing that. Again, in 2009, SLT was about, but we were still learning about it because SLT came about in the early 2000s as a clinical procedure that we could use. And we were still doing 180 degrees versus 360. And it was still a treatment that was thought of let's exhaust medications first. We put them on drop 1, we put them on drop 2, because that's how we did ALT, which was the previous version of laser trabeculoplasty. So if we did ALT that way, well, let's try SLT that way. And it really took us a decade plus to learn that this laser is a little bit different. It's probably safer, it's gentler on the tissue, and we can utilize this more first-line therapy. But when we're talking optometry specifically, when optometry is treating first line, it's drops and drops because that's what we have available. But now that the laser has become more readily available, I think we have an educational opportunity to educate optometrists, ophthalmologists included in that, on that we can utilize this earlier in the course of therapy and maybe reduce the burden of medications for some of the patients that need it. We all know we have patients that have dry eye disease, meibomian gland dysfunction, et cetera, et cetera. And while these wonderful drops, we've got such a wide variety of eye drops now, and they work very, very well, but they're not for every patient. And we have patients that struggle with eye drops, whether it's compliance, whether it's the cost, getting the medications, or just the potential side effects. Again, they're dry eye, they're MGD. Having the ability to go earlier in the course of therapy of an SLT and keep that patient off of drops or reduce their dependence on drops is certainly a benefit for that patient. But it's going to take time. It will take time to get all of this knowledge kind of spread everywhere across the span of optometrists. If somebody once told me that it takes a generation to kind of shift a way of thinking, and that's not mean that we did it wrong before. It's just new information, new data, and we change and we evolve. Now, I don't know if it takes a decade, 20, 25 years, but I think we're in that process of going, we have a treatment modality now that can kind of shift and be earlier in the course of glaucoma therapy.
Yeah, I know you're spot on. And the two interviews I had before this were we mentioned SLT, Hardeep Kataria and Bida Asghari. We were talking about SLT as early intervention, and that's certainly your young generation starting to think about this. They had some fantastic points, so if you missed that, hopefully we can get it on demand. What ways is SLT technology like Digital Duet from Lumenis assisting the future optometrist? There are a couple ways you could break that one down.
Well, I think it's assisting in obviously patient care, number one, of providing a safe, efficacious treatment for our patients that lowers their eye pressure. We still, to this day, the number one modifiable risk factor in glaucoma is intraocular pressure and reducing that intraocular pressure. So when it comes to SLT, having a modality that reduces their pressure anywhere from 20 to 35%, depending on the predictive factors, we know that we've got a nice product that can reduce IOP and reduce that medication burden in some patients. But again, when it comes to education and looking at both the students, residents, and even patients, to be able to take photos and take videos in real time as we're doing this procedure, and to show a patient, this is such a gentle procedure. I show patients going, here's where we're going to be treating. We call this the drain of the eye or the angle of the eye. Here's what it looked like before. And here's what it looked like after. So to have that built-in imaging with the Digital Duet and show the patient, see how we didn't change anything. This treatment was so gentle to your tissue, it just utilized your own body's natural responses to clean up the drain of the eye. Again, here's the photo before, here's the photo after. Do you see any difference? And patients always say, no, they look exactly the same. That's how gentle this treatment is. So having a modality that works so well, very safe, very gentle, while at the same time being able to capture those real-time images and photos certainly makes things very nice.
Yeah, 100%. And Lumenis certainly innovates when it comes to those technology capabilities. So just having those image libraries and all of that is critical for education. A device just can't do the procedure alone. It's got to have that memory so that individuals can learn from previous procedures. That's fantastic. When you're thinking about, I'm more so curious. Can you dive a little bit into how long does an SLT take, and what does the procedure look like from end to end for those? I'm thinking we got to do a live SLT is where my mind's going right now at the next Eyes on Glaucoma. But tell us a little bit about the procedure overall.
Yeah, that's really a good idea, Matt, for people just to see that how this works, and there's really no major structural modifications. A typical SLT obviously depends on the patient, but somewhere between about 3 and 6 minutes if doing a full treatment on an eye, meaning a 360-degree treatment on a right eye or a left eye. Now, again, that can vary based on the patient, based on the experience of the treating clinician, but on average, it takes about 3, 4, 5, 6 minutes to do a 360-degree treatment. Now, we do have different lenses that have come about recently. The Rapid SLT lens came about, which was a 4-mirror SLT lens, which cut my SLT time down by about 30 to 40%. Wow. Because it had 4 mirrors. So instead of having 1 mirror that you had to rotate and rotate and rotate and rotate all the way around the eye, to have 4 mirrors where you can treat 1, 2, 3, 4 different mirrors, rotate it 1 time to the obliques, and then do that again, a 360-degree treatment became much more of a rapid treatment with that. So SLT, very safe, very gentle. And it's about a 3 to 6, 4 to 6 minute procedure when we're doing that on the patient.
Yeah. Definitely quick, and certainly the innovations keep coming. We love our innovations. There's no doubt about it. What are you looking forward to when it comes to just scope of practice expansion, whether in your state or others?
Yeah, well, I think it's exciting. Optometry, we're a legislated profession and we continue to evolve. You think back 50 years ago, optometry was a dropless profession. We couldn't dilate the eyes. We couldn't treat a red eye. We couldn't treat glaucoma topically either. And again, that wasn't that long ago, in the 60s and 70s and even into the 80s for some states. When I graduated in 2009, there was 1 state that had optometrists doing laser procedures. That was in Oklahoma, where I did my residency. And now there are 8 states where optometrists have laser capabilities. So I think you can just see the natural trend from dilating drops to topicals to oral medications, now to injectables and some office-based procedures like SLT. I think we're seeing where we're likely to go over the course of the next 5, 10, 15 years. And I think that's exciting, because who treats glaucoma first line? Optometry does. Now it's not all 100% is optometry, but the biggest piece of the pie is optometrists across all 50 states treating glaucoma. And in many states, optometrists are forced to go to drop first line therapy when the Light trial, the SLT med study, among others, say that we do have a laser that can be and should be used first line therapy for patients where it may be the best option. Again, whether it's compliance, whether it's cost, whether it's potential side effects for drugs. So what gets me most excited, Matt, is where optometry will go over the next 5, 10, 15 years, is optometry being able to potentially do SLT as first-line therapy. I think that's a win for patient care. So going forward.
Yeah, totally. And thank you for bringing that up. And we've actually got this great article, The Scope of Practice of Optometry in the United States. And Dr. Damon Durker wants to know, he's in the chat here, he wants to know how many states do you think over the next, I think you said 10 years will be able to, or 5 years will be able to do SLT, if you had a guess. And I'm going to pull up the current list here. It looks like Alaska, Arkansas, Kentucky, Louisiana, Oklahoma, and Wyoming. I believe that's pretty accurate. We just updated this. What do you think for the future? Is there any states about to maybe switch on their SLT rights for ODs?
And you throw in Mississippi, just passed a laser law recently. That was the capsulotomy only. Yep. Indiana as well. So I always list 8 currently. The ones that you listed, the ones I listed. In the next 5, 10, 15 years, I envision that there's going to be another maybe dozen states. It's a complete guess and pure speculation on my part at this point. But I think by 2030, we are going to be in the teens, if not even in the low 20s at that point, meaning an additional, 10, 12, 14, because again, it's a win for patient care. It's a safe procedure. It's repeatable, as we've talked about. There's no structural damage to the tissue. So if you had me guessing, I'd be guessing in the high teens, low 20s. Certainly, we're a legislated profession, and there's a political component to that. As scope expansion happens, there's push from both sides. But that would be my guess going forward.
Yeah, absolutely. And as glaucoma continues to advance, we've got implantables now, MIGS, there's all sorts of things. And so there's no doubt about it. There'll be some shifting around. And I will add those to, I'll have our editorial team add those to the list. And Dr. Durker here says, what education needs to happen to give ODs the confidence to incorporate SLTs into their practices? And that's such a good one because, you know, the shows like this, that's exactly what's on our mind.
Yeah, I think education happens at multiple levels. Obviously, we start with programs like this, whether it's virtual or in person. Most of the education happens during optometry school, residency, things like that. ODs are well equipped as they graduate optometry school and residency to handle these procedures. But you have to have a couple of other key procedures in your arsenal. You've got to be comfortable with gonioscopy, which is critical for glaucoma. We've got a glaucoma meeting here. If you are comfortable with that lens in your hand and on the eye, that gonioscopy lens, and are comfortable with what you're seeing, that is a big step towards doing selective laser trabeculoplasty. But we always tell doctors and students and residents, training happens at really 4 different levels. It happens didactically in the classroom, watching videos, studying, reading up on a procedure. That's number 1. You get the theory in the background. Number 2 is in the laboratory, hands-on training of actually getting, you're behind the laser. We're on Model Eyes. We have fantastic Model Eyes now. I saw an email came across my desk this morning of MIGS Model Eyes for ophthalmology as they're training on that. And I looked at that and went, wow, these are fabulous Model Eyes. We have the same thing for SLT, capsulotomy, iridotomy. So to me, the second level of training after the classroom is now I've got hands-on. I've got the actual laser lens on the model eye. I'm seeing what I'm seeing as I'm doing this procedure. I'm rotating the lens, getting that hands-on training. And then being tested on that, I think, is important. And then the last level of training is certainly doing these on live patients under the supervision of other doctors if you're a student or resident going through your training program. So again, multiple different levels as you're doing that. If you're a doctor that graduated 10, 15, 20 years ago or beyond, certainly you've got the theory, you study up on that. But again, taking training courses where you have the opportunity to sit behind a laser, get familiar with the knobs and the buttons, and okay, here's where everything is at. What I think a lot of doctors are going to find is what's the skills to do an SLT, a YAG capsulotomy. Your eyes are behind the oculars. You've got your hand on a joystick. You've got a lens on the eye. It sounds like a slit lamp procedure. Now, I'm certainly not wanting to minimize that, but a large portion of the skills are slit lamp, gonioscopy towards doing that. So get comfortable in these laser training courses that are put on quite often, and that's a big step towards getting trained in these new procedures.
Love it. Yeah, and for those that don't want to wait, just Google Digital Duet Lumenis, and you'll see they have a great page here, some fantastic videos and a few different kits you can download to start learning more about this, whether you're in a state where you can do SLT procedures or it's just something you want to learn more about. They definitely have some fantastic resources there. Any favorite feature of the Digital Duet that you like the most, or how long did it take for you to get comfortable with using it?
Well, certainly, the optics are very, very nice when it comes to the Lumenis lasers, the products that they have. Again, that Digital Duet or Digital Trio, the Trio has the SLT, it has the YAG, and has a green laser, which certainly the green laser is the laser that we use the least of the 3, but we do utilize that from time and again on doing laser peripheral iridotomies, on brown irides, things like that. But probably my favorite feature is having the ability to have that live image there, to take a snapshot, to take a photo, to take a video certainly is nice. I'm in an educational institution, so education is near and dear to my heart. To have that student right over your shoulder, watching as you're doing the procedure, or more often it's me standing over the student's shoulder as they're doing the procedure. So I have a comfort level watching that, having videos available for teaching, for lectures, for studies. The imaging capability built right in is certainly novel and a fantastic feature of that to go along with optics and the superior performance of that as well.
Love it. Definitely check it out for those interested. And Nate, just like you said, you've done an incredible job educating those ODs watching throughout the Eyes on Glaucoma event. So thank you for all of your participation and your contribution. We couldn't have such a great show without you, so I really appreciate it.
Thanks, Matt. It's my pleasure to be here. Really enjoyed it. Again, a tremendous job done by you and everybody at Eyes On. Just a great platform and really enjoyed it. Thanks for having me.
Absolutely. Thank you, and we'll catch you again soon.